productioncrate.com.
Welcome to Cardiology Unit. What we do here is to diagnose all heart-related diseases or heart-related issues. So when you diagnose, there's diagnostic approach in management these problems or diseases. So we give optimal treatment and management to patients. So the first thing we do here is we have the ECG machine. The ECG machine is what we use to diagnose patients who have irregular pulse, who are presented with chest pain, like angina, those who have pain radiating to the shoulders or the back. So ECG, like it implies, is electrocardiogram. It has to do with the electrical part of the heart. So it's one of the tests here, like a precursor to other investigation. The ECG, from the ECG report or result, we get to understand if the patient can undergo echocardiography. It's like a visual to check the structure and function of the heart. So from the ECG, we also get to understand if the patient can undergo the treadmill. The treadmill is a stress test. We use it to also diagnose for coronary heart diseases. And maybe if you after the resting ECG and the patient is still complaining about chest pain, so you need to stress the heart. So what we're actually looking at in the treadmill is the ST elevation or the ST depression. So we also have the Holter ambulatory ECG monitoring for 24 hours, 48 hours, or 72 hours as the case may be. The reason for this is to be able to detect cardiac arrhythmias. We actually have different types of arrhythmia, like the PAC, premature atrial complexes or contraction. Then we have the PVC, premature ventricular contraction. So we use the Holter device to monitor the patient cardiac rhythm to be able to ascertain the type of arrhythmia that is responsible for that such palpitation. We also have here the ambulatory BP monitoring. We use it to also check patients who have variability in their blood pressures and all of that. So we can program the patient for 24 hours as the case may be. All right, this is a typical cardiac defibrillator. What it does is to defibrillate the heart during emergencies. So the defibrillator is composed like this particular type is entails on the manual and the automated. Like this is automated defibrillator, and we also have the manual. You can also switch to the manual. So this is the manual part. When you have those patients who have cardiac arrest during emergency, so what we do during CPR, you have to bring the defibrillator to defibrillate. What it does is to reset the heart so that you can get a sinus rhythm while you enhance with CPR, chest compression. So it also has the automated part. So if you don't have the automated part, you can also use the manual part where you pull the chair and shock a patient. So it also has the energy level where you discharge the energy. So you start with a lower energy, gradually you increase the energy. You understand? So the machine also does what we call cardioversion. When you have those patients who have there's something we call a stable SVT, supraventricular tachycardia. So those who are under unstable SVT, so all you need to cardivert, and we cardivert on a very low energy. So this is typical defibrillator. Like I said, we use it during emergency, during cardiac arrest cases to resuscitate a patient back to life. Thank you. Another thing is that these days you find it difficult to see patients presenting themselves in the hospital. I think we would like to also throw more light on that, so to encourage them to present themselves on time, because when you detect this early, it will enable us to diagnose and know the lines of drug or management for this patient. Normally, if you have, like, let's say for instance, you have chest pain, which is also associated with shortness of breath. There's something we call shortness of breath on moderate exertion, or shortness of breath on mild exertion. So if you experience such symptoms and you move from here, or you climb the staircase, you can actually climb this staircase. After some time, you discover that you can actually climb to the end. So that means the situation is getting worse or bad. So that is what we call shortness of breath on mild exertion, because from moderate to mild, so you walk a short distance, you begin to have shortness of breath, accompanied with chest pain, severe chest pain, and all of that. So we also have patients who have heart failure and their legs are swollen. You understand? So they are supposed to be presented when you have bilateral leg pitting edema. It's also related to heart failure. So they are supposed to be presented in this department, where we use the electrocardiography, the echocardiogram, to diagnose this patient. Then you get to see pericardial effusion, and you also have to check if there's structural abnormality. You get to check the ejection fraction, the cardiac output, the stroke volume, and other parameters in such patients. So we are urging the public to present themselves on time, because early detection of these diseases matters a lot. Because if you present on time, you'll be able to tackle this problem so it doesn't get worse. So we also, at Regina Caeli Specialist Hospital, we do orientation, we do publicity, we do free examination tests. So periodically we go to communities and do some tests. So when we detect things like high blood pressure, so we ask the patient to come to the center to come and do further investigation. So let's take high blood pressure, for instance. There are things you're not supposed to be eating when you have high blood pressure. Like, most people don't know this. That is the essence of the orientation and publicity. And when you have high blood pressure, you need to abstain from processed food, minimize your salt intake, red oil. You have to also minimize your red meat intake. So for those who have cholesterol, you can also imbibe on lifestyle modification, doing exercise, and cutting down calories. So these are lifestyle measures you can actually follow to reduce your high blood pressure. Once again, my name is Arun Newton, the Chief Cardiac Physiologist, Regina Caeli Specialist Hospital here in Awka, State.